My name is Louise Fechu. I'm one of the consultants with the Ohio Program for Campus Safety and Mental Health, and I'm also one of the members of the Campus Community Collaborative Grant Review Committee. The Campus Community Collaborative Grant is an opportunity for colleges and universities across the state of Ohio to receive up to $5,000 of funding to help implement programming that reduces stigma, promotes mental health, and focuses on suicide prevention. Today, I have the honor of introducing one of our grantees. When I first read their proposal, I was both impressed by their drive and the impact that they are bringing to their campus. Wright State University really set themselves apart by having the extraordinary goal of having over 2,000 students trained in QPR. Here with us today is Dr. Bashir and Chief Holden. Dr. Huma Bashir is the chair of the Human Services Department and director of the Clinical Mental Health Program. Dr. Bashir was also appointed as the clinical assistant professor in the Department of Psychiatry at Wright State University Boone School of Medicine, where she teaches the cognitive behavior therapy course for psychiatry residents. Chief Kurt Holden is a respected university law enforcement professional and executive leader in the policing community. He currently serves as the Director and Chief of Public Safety at Wright State University. Chief Holden is a two-time alum of Wright State University, where he's earned his bachelor's degree in organizational leadership and master's in leadership development. I am truly excited to hear the updates on their hard work and the steps that they are taking to support the mental health of students, faculty, and staff at Wright State University. So please join me in welcoming Dr. Bashir and Chief Holden.
Thank you so much for that wonderful introduction. I don't know who that person is, but anyways. Well, today I'm really excited to be here with our partner, Chief Holden, who's doing a lot of the work on campus with this initiative. So I'm going to click here. And so I just wanted to give us an overview of where we got started with all of these initiatives at Wright State University and then where we're headed. So 2 years ago, the president tasked us with a charge to implement mental health task force. And that's when I co-chaired with our provost Thompson. And so we started thinking about what is our student needing and what can we do? How can we help with this culture of care? Because we saw that this is also not only a issue of culture and safety, but also an issue of retention, right? Because if your students aren't healthy, the drop rate is going to go high, right? So because, we recognize that it is a problem post-COVID, and then we brought in a lot of the different stakeholders for this task force meeting. So we even had people from as far as Dayton Children's Hospital to all of our departments at Wright State, different stakeholders, because we wanted the voices of everyone as to what the librarians are dealing with, what the arts, CATS department, computer departments are working with. So we started to just listen, and then we started talking about what can we do. So as we all know, I'm preaching to the choirs. I know it was nice to hear the previous presentation, and we're like, okay, we get it. We're all in the same boat here. But as we can see that, a lot of the issues about mental health are increasing with our college population post-COVID. And it's becoming a thing where the faculty was coming to us like, what can I do to the counseling and wellness services? Our students are struggling. How can I intervene? And, with mental health, the stigma is still there. It's not as bad as it used to be, thankfully, because a lot of the campaigns and the awareness has gone in. But at the same time, people think that if they talk to someone too much, they might break them. Like, what can I do? We don't want to cause any harm, right? Do no harm. And therefore, they were really struggling as to how do we intervene. So improving the student success was a big one on our list because this is a retention issue. And not only that, but it's also the safety issue. So as we know, we all noted and we started campaigning around this is important because this is what's going to happen. The GPAs are dropping, and then students are voicing this concern about mental health and how then they are going away to just self-care and then come back to campus. Um, and then we also learned that, our faculty, as I noted before, felt really ill-equipped to work with students, and therefore they were struggling as well. So in order to avoid burnout on both ends, faculty and student, we decided to create some goals, and then we decided to work on our mental health task force and what can we do to roll out some initiatives. So we wanted to make it easier to refer students to our counseling services. So we did an overhaul there. We changed the leadership. I was the co-director of that center for good, I don't know, 4 months. So we had to revamp everything there and bring in more fresh clinicians to fresh. We wanted to clear a culture that was a little bit different, and people didn't think that, oh my God, I have a problem, therefore I'm going into the counseling and wellness center. And then, do you want to add to that culture? I
Yeah,
mean, yeah,
yeah.
you were.
So just like you've seen where staff, faculty felt like they were not comfortable dealing with individuals that might be going through a mental health crisis. Well, part of me at the police department was I initiated an officer wellness program because healthy cops have healthier interactions with people. And so it started with having those of course self-care trainings, those officer wellness trainings that of course then led to, you know what, crisis intervention, QPR, mental health first aid, and of course, beginning to make that part of the actual culture. And that was personal to me because, growing up in foster care from the age of 2, and of course, being on those social programs, many people would actually look at those programs and go, was that a success? 2 to 3% of students that are impacted by the foster care system going to achieve a degree. Well, 2 to 3% might actually become a chief of police, be able to make positive change one day. I am that example. And so seeing those things and of course having those difficult conversations, this is where Dr. Bashir was able to bring the right people to the table to actually start having a very focused and narrow conversation that was going to address the problem.
Yeah, we wanted to move away from the silo approach, right? Because we don't do well. We all have to be part of the solution. So we created some goals, and main thing was we developed a statement to go on every syllabi for wellness statement where students knew that if they had any issues, anything going on, they can always go to the faculty and talk to the faculty. And then we started also working with faculty to help them understand what mental health looks like, what accommodations can be given to students, and just overall, just raising the awareness where we're not trying to penalize the student if they are struggling with something. And how do we work with that? So, with that, we started to look at options. So, we looked at JET Foundation. So, we're very fortunate. Our president put in the seed money, and then we were able to get a grant to get the JET campus accreditation, basically, and integrated. So, we just completed our Healthy Mind survey, and we have the outcomes. So we are already implementing some of the things that the Healthy Mind survey pointed out. Our students do feel connected, that they know that they can go. But then again, everything as we looked at from like as an overarching umbrella big view, with too many clicks to get to the right thing, right? And Kurt can tell you, he knows that there's exactly 4 clicks to get to counseling and wellness. And we were like, no, that's too many clicks for our students. We need to reduce that number. So we started to have those conversations. So right within the mental health task force, we were able to provide mental health first aid trainings to faculty and staff. So last year we were able to train 150 faculty and staff. So that was our initial first cohort that we were able to get through. And it's because, again, giving that equipment, toolboxes, all those different languages to even ask the question and not feel like we're going to harm anyone. And then we didn't know this. And again, we're trying to erase the silo approach. We learned that we have our first responders trained to be trainers in QPR. So that's how we got that started.
Right. So we have 11 trainers right now at our department that are QPR. And so we'll go into more detail about that. But of course, seeing the mental health first aid, it was voluntary, of course, originally, to where we trained over 150 people last year. And then QPR, we just got it off the ground. And then seeing, like we talked about in the panel here, is that having that executive support. And so now we have a large mandate, but all of our employees, faculty, and staff are required to complete mental health first aid and QPR now.
And we did our first mental health first aid training on Tuesday. So we trained 18 faculty and staff already. So that initiative is rolling out. And then Kurt's office is going to get busy with QPR trainings because that's also on the mandate. And then crisis intervention plan and postvention plan. So with the new director at our counseling and wellness services, I think Kurt's office and I think they're also reaching out to the community response, CIT response. So we're kind of much better placed with that as well. I don't know if you want to add.
And then our public safety department, so the police department is the third department, and of course the state of Ohio, to complete the One Mind campaign pledge, which every agency can actually pledge to do, which is going to require 100% of your staff to be mental health first aid and CIT trained, crisis intervention trained. Happy to report that our agency has accomplished that feat. And so what happens now is that when a new officer comes in, there's basic in-service training that is basic for most officers. Well, of course, building those relationships with, of course, Greene, Madison, and Clark counties, we always have a seat in that next CIT class now, because we want to make sure that, these students that are here to be nurses, doctors, engineers, they are healthy when they come in and they're healthy when they come out. And so, of course, that was our goal, of course, working on ourselves so that we can help others.
Okay, here's our stats. So as of now, so another thing that we're also doing at Wright State is the faculty and staff are being taken care of, so to speak, with the trainings that we're providing as a mandate. But then we're also rolling out a peer mentoring, mental health peer mentoring program for our students. So that's where I have a grant from ODHE. So we are about to train about 1,300 students to become mentors. So we're also trying to bring the student body to be able to work with other peers, because peers and peers is a better connection than somebody reaching out to their faculty. But with that, they're required to do the QPR training, and that's a certification, and then they become peer mentors, certified peer mentors for mental health. So we're trying to create that culture of care again with all of these different initiatives, different approaches. And then my hope is we get the funding to provide the mental health first aid for our students, because that's the missing link. We have the QPR, we're doing the run, hide, fight, we're doing the Narcan trainings, ongoing. We were able to install Narcan on nalox boxes throughout the campus, so we were able to get those as well. And it's going on both campuses, Lake and Dayton. So that's nice.
And so a big push is that everybody likes to have like a ribbon or some type of, I accomplished something. So at Wright State, we just started what is called, you can become a campus safety champion, but you have to complete certain things. What you have to complete: QPR, mental health first aid, naloxone, run, hide, fight. And of course, you complete those, and of course, you'll get like a challenge coin and a patch and things that's, just because it helps bring people in the door. And so what you're seeing here is, this is when we first started training back in September. But then we know that when you first try to get someone off the ground, it's kind of shaky, like, hey, is anybody going to support this? Well, we're now well over 200, and it's because we got the support to put it all over campus. So that means when you're walking around TVs, it's just training, QPR training. It's on our webpage, calendar, Engage. And then now we have a set room every single Tuesday. You can come and go. You can come get QPR trained. Regardless if, of course, anybody shows up or not, that room will always be open. With, of course, trainers, we have a backup room because we know that there's a licensure attached. So if, of course, more than enough people show up, we'll have a backup room to ensure that we can properly certify those individuals in QPR.
And I think all of these things come from where we are today in our society, right? We cannot avoid what can happen on a college campus because we're all vulnerable to that. So we decided to implement the run, hide, fight training because of that. Because if we can add, you know how it is with fundings on college campuses, we can all speak the truth here. So we're like, okay, if we can add more police officers, the least we can do is train the folks so they know at least what to do in a situation, God forbid, if we are ever faced with that. And hopefully we're not. So anyway, so this is all what we are doing. And the $5,000 we received will go a long way. So we bought a lot of the kits because that money was designed to get the kits for the QPR training because you can get certified and everything is copyrighted. So we were able to get the fundings to provide those kits so we can continue to train our students, and we'll do at least 2,200 is what that
Yeah.
budget is for. So I think that's that. And then with our ongoing efforts
Yep.
to bring as much other resources in the plays is what we're trying to do.
Yeah. Because like Dr. Bashir said, like of course it can be difficult to get funding, and then just like the panel said about finding the right staffing. And so my philosophy is that if I can't get more cops and we can't get more clinicians, then we just have to get healthy, because healthier communities make safer communities, and safer communities are healthier communities. So we have to start doing that work then, because if of course we just think that having a couple more staff is going to fix it, we got to start actually getting the work in. And so that's what we're doing. We're putting in work now. So it's fun and challenging.
Yeah. And it's good to have great relationships along the way because otherwise it's hard to do the work, right? We can't solve all the world's problems alone. So, but thank you so much for having us today. We are really appreciative. And you guys have a great day.
Thank you.